Having a stroke is actually the number 4 reason for death in the United States alone, and is actually the primary reason for having a disability. Now, a person can actually prevent a lot of this harm by simply getting professional help within the first 3 or 4 hours. There's medicine that can really help out, but someone has to know what the symptoms are. And that's part of the goal of this video. Now, a stroke really takes place when blood doesn't reach parts of the brain and the tissue, some of the tissue dies. This can happen in between 1 or 2 ways. The first way is when a blood vessel in someone's brain bursts and bleeding occurs in the brain. The second way, which is much more common, is when blockage develops in an artery, and nearly about 85% of all strokes happen this way. Now, the medical community has put together an acronym that helps people remember the warning signs of a stroke. It's known as F.A.S.T. Now, the F stands for face drooping. So if a person's face is kind of numb right here, or it's kind of drooping, their smile is uneven, and that's a warning sign. The A stands for arm weakness, and that's a major warning sign as well. So if you can't lift up your arm, it feels like it weighs 100 pounds, then that's a sign that you could be having a stroke. Next up is S. So when someone has speech difficulties, for some reason their mouth's all numb, they can't talk, then that's a sign too. And the T calls for calling for help. Call 911 or get some more help. Now, besides these common warning signs that I just mentioned, there are a few that are a little less traditional, and many experts believe that women experience these types of symptoms, the less common ones, 62% more often than men do. Now, these less traditional ones can include being dizzy, fatigued, and having trouble walking. Almost if it feels like the person is drunk and intoxicated, but they haven't drank any alcohol. That's a symptom. Also, as blood has trouble moving around the body, the person can have trouble catching their breath, and may have their heart might be racing very, very fast, with some chest pains. That's another common sign. Hiccups, very unusual. Some hardcore hiccups can be taking place. And also pains in certain parts of the body. This could be like in the arms, legs, one side of the face, even the chest area. And lastly, some more signs could be some vision problems that just take place all at once, cloudy vision, out of the blue, and maybe a feeling of wanting to vomit. Now, if a person really experiences these abnormal signs, they should probably get some help. The next best thing to do would be to take some aspirin. And aspirin helps by thinning the blood, which can help a lot. Same thing with like heart disease, a heart attack. Take an aspirin. And if you're wondering if you should chew it or swallow it, you should chew it. It's better that way. Another idea, which is great, is just to help prevent this stroke in the first place and really increase your chance of not getting it. And there's a lot of things that can do this. One is not to smoke tobacco. Cigarettes, just very harmful. It's been estimated that smoking tobacco doubles the risk of strokes and does so many other bad things. I think like 80% of all people that have an aneurysm smoked or used to smoke, something like that. Also, being diabetic doesn't help at all, overweight. Another idea would be to actually take some herbal remedies and supplements that can really help improve blood flow and really help your health. Now, a list of dietary supplements is just so gigantic that can help, but I'm just going to go over a couple of them with you right now. The first herb can really stink up somebody's breath, and vampires are afraid of it. Can you name what it is? Well, if you took garlic, then you're right. That's what it is. Another great idea would be, of course, drink a lot of green tea or take green tea in a supplement form. By looking at 9 different studies with 195,000 people, it's a lot of people, people found that just drinking 3 cups of tea per day reduced the chance of a stroke by 21%. Now, before you go out and start buying a whole bunch of dietary supplements to really improve your health, there's a few things that you really should know about. For example, the Government Accountability Office in the United States tested 2,000 dietary supplements from all kinds of different companies. And they found that 25% of them, a quarter of them, were mislabeled or had some harmful contaminations that were harmful. Now, the reason for these crappy supplements in the marketplace is simply because nobody really tests these products to make sure they're safe before they're sold out there. Now, to make things a little bit easier for you, because I'm sure you're a busy person, I've actually kind of came up with this guide that I feel can really help somebody in the whole process of going out there and choosing and buying these dietary supplements. Now, this guide goes over a few of the warning signs. They'll tell you that a product will most likely be harmful that you might not know about. It also goes over various herbs someone should really consider, as well as various herbal products that do a lot of damage. And these herbal products are actually in common ingredients, like even cough medicine. Now, this guide is completely free, and if you want to learn more, all you gotta do is simply click on the link right below this video that I made you. I really hope it helped a few people out there. Thank you so much, and enjoy the rest of your day.